Hello, I'm Representative Ralph Boehm, and welcome to District 18. For those who don't know, we are in New Hampshire Senate District 18, which includes Litchfield and Manchester Wards 5, 6, 7, 8, and 9. And on this show, over the next months or so, we'll be discussing politics, legislation, local issues, etc. My first guest for this show is another state representative from District 18, Victoria Sullivan from Manchester Ward 9. So welcome to my first show, Victoria.
Thank you. I'm actually District 16.
Victoria served with me on the House Education Committee, but tonight we'll be discussing a few other things, including the New Hampshire Health Protection Program, also known as Medicaid expansion, the drug problem, and if we have some time, some education bills. So first on Medicaid expansion. And Victoria, I know our time is limited, but what is wrong with this law?
What isn't? So this was supposed to sunset and no longer be a burden to the taxpayers. However, we had legislation come through that has now expanded this for another 2 years with another theoretical sunset. However, the stipulation for a work requirement was removed in an amendment. So now you have able-bodied adults between the ages of 18 and 64 who will be on taxpayer-funded health care. So that's the problem. Meanwhile, we've got seniors that are on Medicaid that have expenses going up and up, and their Social Security is not matching those increases. So there's a lot of problems with this. Also, the federal funding that this is based on is, word is, it may not be as stable as was once thought, but either way, state-funded or federally funded, I think people need to remember that the only funding comes from we the people, and the government does not have a job. They do not sell anything or manufacture anything, and it's the taxpayers that are on the hook for this. And again, we're talking about able-bodied people without children who are able to work for a living.
Right, and the thing is, it's if they don't work, I mean, they can work, but as long as they don't work more than 30 hours, they can be covered. Now, that was the whole thing with Obamacare. Everybody's going to be covered. We can go online and go on into and get our insurance. Unfortunately, I guess that was another lie, because here we in the state are going to be paying for that. Mm-hmm. And one of the reasons, and one of the ways it's going to be paid for, because I know there's been articles written by other people about it's not going to cost us anything. Because it's going to be paid for by the federal government, which we know how that works, and what I've heard is being taken out of the next budget already.
And don't forget, the hospitals are going to eat the other costs, and the insurance company is going to eat the other costs. And I think anybody who's been around over the last 6 years that has private insurance knows that that other cost is not eaten by those companies, but they're passed down to the people that are paying for the private insurance. So in my own household, over the past 4 years, we've seen an increase of almost $300 per month in our premiums. Meanwhile, our benefits have gone down. Right. to cover the costs the insurance companies are not eating, because they won't. And we're going to see the same thing in the hospitals. The other problem is a lot of companies now are not going to offer a 40-hour work week. They're going to keep it below the 30 hours so these people can be on the Medicaid expansion, and they don't have to incur the costs.
Yeah, because that was one of the problems. Oh, yeah, the insurance company is going to pay for this with donations from a premium, basically a premium tax, what it comes down to, and hospitals also. But you know how that works. Insurance companies are there to make money for their stockholders, which could be you and me or whoever owns stock. So their donations are going to be passed on as premium increases. The hospital, quote, donations are going to be passed on by higher increases, which for the insurance companies. So we got this thing that
and
going to be stuck.
The other argument that people used in order to pass it was that it was going to reduce the strain on emergency rooms. And we found in the 2 years that it's already existed that that has not been the case. In fact, people are using emergency rooms more than ever because now it's paid for.
Right, and the problem is they can't find doctors to start with. One of the things with Obamacare, because my doctor told me, he's limited on how many patients he can have.
Right.
And he's been told, you have too many patients. And there aren't that many more doctors in the state that can handle all these 47,000 people that are going to be covered. So they're still all going to go to the emergency room.
And the bottom line is the federal government is not good at taking care of much. They're not good at running. I mean, if you look at the VA hospitals and the problems that we're seeing there, and I mean, these are serious, serious issues. We've got people dying on wait lists locally because the government they don't run things well. They don't even run the government well, never mind getting them to run hospitals or your medical care. It's not where they should be, what they should be doing. And like I said, we see it in the VA, and we have horrific stories coming out of the VA. And we've had senators, we had Congressman Ginta, we had Senator Rand Paul. A lot of people came out and wanted to hold these people accountable, and nothing could happen to them because they were government employees and they were completely protected. Meanwhile, our veterans, who we should be protecting the most, are not getting the care that they not only deserve, but many of these veterans need the care because of their service, and we're not taking care of them. Right. So it's a bad deal for the state. It's a bad deal. We've seen it in the states that already passed Medicaid expansion, and we see that we had people come from other states governments to say, hey, we did this in our state and it's a really bad deal and we're struggling because of it.
Yeah, I believe Maine.
Yeah.
There are 19 other states that have not done the Medicaid expansion because they see what's going to happen. Also, part of this law, which is now a law because the governor signed it, is if the federal government doesn't do the percentages they say, this law will cease in 100. It used to be immediately, but now it's 180 days. You know what that means? That means 6 months to get the legislature to do something else. So just like it was supposed to sunset, and we know what's going to happen.
So who pays the bill for 180 days for 50,000 people that are on it?
Right. So that's, and the state will notify those people you will no longer be covered. Yeah.
I had people come to me that had, one family in particular, they got help through one of the private hospitals. They were on a sliding scale and they would make payments to the hospital. It worked out really well for them. When the Medicaid expansion first came in, the hospital no longer offered that plan. They were kicked onto Medicaid expansion where they didn't want to be. They were willing to pay their fair share. They just needed a little help getting there. And they were really upset this happened. I also had college students, you saw it across the country, that were pushed onto this. There was a law student that came out. She said, I have money, but I don't have insurance because I'm a student and I've always paid my own insurance, and now they're telling me I have to have Medicaid expansion. And colleges used to offer, a limited health care because when you're young, you don't need it so much. But that option was taken away from them with the Obamacare and the Medicaid. So
yeah, there are some holes even in New Hampshire was always a law about, before Obamacare started, about if you're under 26, you can be on your parents. That was law in New Hampshire before Obamacare. There's still a problem with that. There are some people that are below 20, that are under 26 that cannot be on their parents' plan because the parents are on Social Security, Social Security disability, so they cannot be.
Right, but I think that's backwards. So if you're 26, get your butt out, get a job,
Get a job.
and let your parents be on your health care. They took
That's
care of you their whole lives. Now
point.
they're, they need help. Let them be on your health care.
But the problem is, how many people are saying, well, if I work more than 30 hours a week, I'm going to have to go on the exchange and pay for my health care. So I'm just going to work 30 hours a week.
Yeah, even on the Medicaid. So even if you
home.
worked your whole life, you paid in your whole life, and this is what my parents are dealing with right now. They're on Medicare, but it only covers so much. And if you have, health issues, and, my dad's diabetic, and they have certain issues they have to deal with, they can't be on just that. And even the Part B, they pay an extra $500 per month for their insurance out of pocket. Well, there's two of them. But $500 out of pocket every month.
Yeah, maybe between two.
Yeah, and Dad has health issues, so I'm sure that tacks it up. But they couldn't do it without that. No. So now you're in a fixed income. Then you've got your Medicaid you're already paying, or Medicare you're already paying. Then you have to pay your supplemental, and
And
you've
the
got
drug
young
plan.
people who are willing to, are able-bodied. They can get a second job to make ends meet, like a lot of people do, and they get free health care. We have it so backwards.
I know, and that's the problem. Why? So a lot of young people saying, "Hey, why work? I can work 30 hours a week and probably make more money because I can be on Medicaid expansion and I don't have to pay for my own insurance."
Well, you've heard it, Ralph. You've had people say to you, "I can't afford to work full-time. I can't afford to give up the benefits." We have it so that people are now enslaved to the government welfare system. Instead of having it be a step up to help them out, now we have it so they can't afford to get off of it. And you see it and you see people who honestly want to get off the system that say, they don't make it so that I can afford to do it.
Right. I know. It's
There's a
completely
lot
backwards.
to look at and fix.
And, it's like a little common sense, and we don't seem to have any.
Nope.
Okay.